Hi, I'm Dr. Charlie. I'm a lead GP and a senior university clinical educator. In this video, we will discuss how we measure renal function using eGFR, how we should diagnose chronic kidney disease or CKD, what is ACR, and how we should diagnose microalbuminuria. We will then explore options how to treat this condition in primary care and when should we refer to hospital services. Coming right up. Kidney is a vital organ that functions to remove waste and extra fluid from the body. eGFR, or estimated glomerular filtration rate, is a blood test that measures the function of the kidney. It measures creatinine, which is a natural breakdown product of the muscle, filtered and excreted by the kidney. So if the kidney is not working well, the blood creatinine level will rise. eGFR is then calculated based on age, sex, and creatinine level. eGFR is not a perfect test and can be affected by ratio differences. Black people tend to have more muscle mass and have higher creatinine level with similar renal function. It is also less reliable in pregnancy, children, being muscular, being malnourished or having reduced muscle mass, being dehydrated, or simply having a large meat content 12 hours before, or simply being on protein supplement. All of this can affect eGFR level. Normal GFR, especially in a young person, is more than 90. GFR of less than 60 for the first time will require a repeat blood test at 2 weeks to check for AKI. Chronic kidney disease or CKD is a condition when there is an ongoing reduction in the renal function and can be part of the aging process. CKD is diagnosed when there is a repeated reduction in the eGFR of less than 60 for at least 3 months. eGFR of more than 60 is close to normal and is related to normal range in young adult, bearing in mind that there are many factors mentioned previously that can affect eGFR. Kidney disease is excluded unless there is more than 3 months abnormality in other tests such as microalbuminuria, hematuria, or structural abnormality. It is still quite reasonable to continue monitoring renal function in this group of patients. ACR, or albumin to creatinine ratio, is the test that measures microalbumin or small protein being excreted by the kidney. It is used to detect early damage to the kidney and it is more sensitive to PCR. If ACR is more than 3, it is advised to repeat in the subsequent early morning sample. If, however, the ACR is more than 70, there is no need to repeat the urine sample. NICE has produced CKD Classification based on eGFR and ACR into G125 and A123. Diabetes and hypertension can lead to renal impairment from intraglomerular hypertension and hyperfiltration. Microalbuminuria indicates glomerular damage, although eGFR may appear normal. eGFR and ACR are independent predictor of cardiovascular outcome. In short, eGFR is the measure of the kidney function based on the kidney ability to clear creatinine, while ACR is the measure of the kidney structure. Damaged kidney will leak more protein. Microalbuminuria can be diagnosed when ACR is more than 3 for at least 3-month interval. Let's talk about management of microalbuminuria. First, you want to control blood pressure to below 130/80. Next, you want to prescribe ACE inhibitor or ARB. As mentioned in my previous video, ARB is preferred to ACE inhibitor in black population due to risk of angioedema. You want to aim HbA1c target at 53. in the CKD3 group of patients, you also want to prescribe a 12-hour statin 20 mg. Now, following successful CREDENCE and DAPA CKD clinical trial, SGLT2 is found to have significant renal protection, and I will leave the links in my description below for more information. You want to offer prescribing SGLT2 such as dapagliflozin 10 mg once daily in patients with ACR of more than 30. You want to consider prescribing SGLT2 in patients with ACR between 3 to 30. In general, we can diagnose and manage CKD and microalbuminuria in primary care. You may want to consider referral to renal services if there is a reduction in GFR by 25% over 12 months, or if there's a change in category or sustained reduction of GFR by 15 over that time period. You want to refer this patient for renal ultrasound. You want to perform full blood count if eGFR is below 45, looking for anemia. You want to perform blood test checking for bone profile and parathyroid hormone when eGFR is below 30, looking for secondary parathyroidism. Thank you for watching this video, and why don't you check out my video on the summary to the oral management of type 2 diabetes based on NICE Guideline 2022. And don't forget to click subscribe to my GP Team Academy channel for more content like this, and until next time.